and as a member of the Italian study group on management, quality, and safety in pathology, he is the senior author of the document on the management of the biological risk from SARS-CoV-2, edited by the Italian Society of Pathological Anatomy and Cytopathology, published on March 24 of this year. So, please, Dr. Barbareschi.
Thank you very much, Marco, for the kind presentation. Thanks to everybody. Thanks to the Society for giving us this opportunity to get together and speak about these topics. So just to let you know, I live here. It's a very small area, mountain area, very close to Lombardy, which has been one of the hotspots of the infection in Italy. And many people came skiing in our area, infecting all the areas with a lot of ski restaurants. So this was the reason why I have been so interested in biosafety in our institution. And I think that we as a pathologist have given the right importance to biosafety. We were always concerned about chemical risks, but the formalin ban, and we probably have a little bit skipped our attention from the biosafety problem. So just a few words about what is the concept of biosafety. So we have to assess the risk which we are facing, which means characterize the hazards, and then we have to identify a strategy to mitigate the risk, which is risk mitigation. We know that WHO classifies microorganisms in 4 groups according to their infectious activities, their danger for the community. So we have from risk 1 to risk 4 an increasing gradient of risk. Paralleling the increasing level of risk of the infectious agents, there are measures which are clearly defined how our labs have to cope with this risk. And these are the biosafety level. It goes from level 1, which is the basic, to level 4, which is the maximum containment level of biosafety. Now, what we can say about the present situation. We know that SARS-CoV-2 is classified as a the risk-free group. This is very important. It's a risk-free group, which means it's a high level of risk. We need to have our lab having all the protections which are equivalent to a biosafety level 2 as defined by the WHO. Now we should look a little bit inside this biosafety level. What are the requirements for a level 2 biosafety? One of the main issues is the availability of biological safety cabinets for all procedures which can cause infection from aerosols. There are 3 levels of biosafety cabinets according to international rules. Class 1, which protects the personnel working by the cabinet and the environment. And Class 2 and Class 3, which provide personal and environment protection and also protection of the product. So what we are working with inside the cabinet. And then there are a series of other requirements. I just summarized some of the most important, which is the availability of the appropriate personal protective equipment, prevention of injuries, daily decontamination, appropriate disposal of contaminated material. Now, what to do in the actual situation? We have to reassure most of our personnel that everything which has been properly fixed, either in formalin or by alcoholic fixation, and even more if it has been exposed to heat, like in when we embed the tissue in paraffin, is at negligible risk for our safety. So we can manage all this material with standard procedures. But we can have materials which are not formalin fixed or alcoholic fixed. And we have fresh or inadequately fixed materials which can contaminate the surfaces by splashes, or we can generate aerosol droplets during several cytopreparatory steps. And as something we have to think also about is that paperwork coming from the clinical units or the jars may be contaminated in the surface. So we have to focus a little bit on transportation of our samples. It's better to have the samples delivered by hand. Better if the samples are identified when they are from positive or suspicious cases, and these cases should come in the lab in a secondary bag, disposables bag, to protect the technicians and people transporting the samples. And even paperwork may be a source of infection, so better have paperless electronic request. And this can be the moment where we not only have electronic order entry, but we can also reduce the paper going around our labs. So what are the possible sources of contamination? So unfixed surgical and cytological specimen, and I include this the problem of all the frozen sections and all the specimens which are collected with this formalin-free vacuum technology, which is very popular now because of the formalin ban. Then we have inadequately fixed surgical samples. So typically, a few days after the start of the pandemic, we had lung samples which arrived in the lab, and these were as usually floating on formalin, were not fixed. So these are samples which can be at risk. All the liquid-based cytological samples, which are collected in transporting mediums, which do not guarantee viral inactivation. I have asked the companies if they could give us more detailed information, but they only say we do not know whether or not our transport medium may inactivate the virus. So we will be very careful. Sample for flow cytometry, and all what is done by fine needle aspiration procedure, otherwise procedures which have been performed by us as pathologists, or when we are just helping, like when we go for rows in the clinical units, and even more importantly when we do EBUS, fine needle aspiration. In my view, we have to treat all these samples which are not fixed as possible sources for contamination, disregarding whether or not they are indicated as positive or suspicious by the clinician. And importantly, now we have to think what we do in the lab. All organization says that we have to use class 2 biological safety cabinets. As I told you, these are the cabinets which protect the environment, the personnel, and the product inside the hood. These are not very, at least in Italy, they are not very popular. We mostly have chemical hoods and not class 2 biosafety cabinets. If we do not have biosafety cabinets, or if the instrument cannot be used inside such a cabinet, we have to adopt extra precautions which can provide a barrier between the specimens we are dealing with and the personnel, which means personal protective equipment or other physical barriers. In my opinion, also class 1 biosafety cabinet, but this is personal opinion, should be adequate because they protect the personnel and the environment. We do not have any need to protect what we are dealing with inside. We are not doing tissue culture or other things like that. Fume hoods without high efficient particulate air filters, and especially those fume hoods which recirculates the air inside the lab are not equivalent and should be not considered equivalent to a BSC. Personal protective equipment, I think that we have to distinguish whether or not we are dealing with material which are formally fixed and material which are unfixed or inadequately fixed, and whether or not we use a BSC. So if we have to work with inadequately fixed or unfixed samples outside a biosafety cabinet, we have to wear the FPP2 or 3 mask. We need eye and face protection, double gloves, waterproof gown. And we have to instruct our personnel how to wear, undress, and dispose this PPE, because if you speak with your colleagues in the emergency room, they explain you how important it is to undress properly with the protections. Otherwise, you can got infected through the protection itself. So I am going back, focusing just for briefly, surgical samples. As a general rule, they must, if they are not fixed, we have to manipulate them within a biosafety cabinet or with appropriate PPE. And if we cannot guarantee adequate protection, our indication of our society is to suspend formalin-free vacuum collection of fish specimen and to try to fix the samples, especially those from the lung, gastrointestinal samples, inside the jars which we receive in our lab, maybe injecting formalin inside the lung, or grossing, giving a sort of preliminary grossing of the sample within the jars. Concerning cytological samples, it's important to distinguish probably the samples which are higher risk, which means samples from the upper and lower respiratory tract, from other blood and feces or material coming from the gastrointestinal tract, from those which are at very low risk, and like urine, where the data about the presence of viral particles are at least scarce or probably not really convincing. So the most important samples we have to focus on are those of the upper and lower respiratory tract. Which are the steps which are very important to focus on? Are all these steps which can produce an aerosol and droplet formation, which are listed here and you find in several documents from the international agencies. So opening containers, but especially when you do, sorry, my phone. And a last word about liquid cytology. Liquid cytology is it's important. We have a lot of samples coming in liquid cytology, and the collection and transportation in this in cytolite for horologic technology is not, it's at a concentration, alcoholic concentration, which is not high enough to be sure that it's inactivating. So these samples have to be manipulated very cautiously. Few words about frozen section, fine needle aspiration, and rows. We should discuss with our clinician whether or not these activities are really important for the patient. If they have a diagnosis, will affect the patient and give a change in the management. You can read somewhere that you should discourage or avoid this activity, but I think it's really tough to do not a frozen section if the clinician asks you to do it. we have to minimize and people working around in these activities, and they have to always to wear appropriate PPE. And this means, especially for if you go to do rows in EBAS, TBNA, to use FFP2, T3 masks, and use biosafety cabinets whenever possible. The contamination is another issue. It is very important because the virus may persist on steel, plastic, cardboard for a long time, and we have to be very compulsive in the contamination of all our surfaces. So in conclusion, just to remember that biological risk management is something we have to think about probably more intensively than we have done in the past. Remind and to our colleagues, and when we are working with fixed samples, we are not at risk, they are negligible or absent. And while when we deal with unfixed or inadequately fixed specimen, we have to adopt all the safety measures which are described in BSL2 labs. And probably we have to have a coordinated approach to biological and chemical risk in the future. And with this, I thank you. These are a few references for the audience where you can find many of the indications from the international agency which have produced a very large amount of documents on this topic. So thank you very much for your time.
Yes, thank you very much. And now I want to hand over to Professor Gustavo Barreton. He is the director